First and foremost, we have Dr. Banu, madam, Dr. K. Banu. She has a vast experience of over 35 years as a neurologist. She's been instrumental in establishing the neurological department in various private and government institutions. She's passionate about treating epileptic patients and is also the brainchild of a program that provides epileptic patients with the tools to become self-sufficient individuals. She believes in spending time and getting into the depths of neurological issues for every patient. So Dr. Banu, thank you so much for joining us here, taking time out and being here with us today. So it's genuinely a pleasure to have you on the webinar. Also joining her for discussion, thank you, ma'am. Also joining her for the discussion is Dr. Nandini. Dr. Nandini Edumala is trained in emergency gynecology and obstetrics, postpartum hemorrhage, shoulder presentations, labor management with complications, high-risk pregnancy, all of that is part of her forte of skills. She's also equally passionate about family welfare planning, puerperal sterilization, laparoscopic sterilization, and much more. And yes, she's also a very, very strong advocate for women's health. Thank you, Dr. Nandini, for joining us here today.
Thank you.
All right. Also joining us on the show is Dr. Swati Raju, a young and dynamic liver transplant hepatologist. She has gained her experience working with stalwarts like Professor Mohammad Rela, Dr. Joy Verghese, and Dr. Jayanti V. And she's been extensively involved in managing all types of liver disease, pre-liver transplant workup, and optimizations of the patients and post-transplant clinics, as well as she does a lot of endoscopy as well. She's also worked as an assistant professor in the hepatology department in Sri Ramchandra Medical College, where she helped in developing the liver transplant program. She has a lot of interest, especially in hepatocellular carcinoma. So I welcome Dr. Swati also on the show. Thank you, Dr. Swati, for joining us.
Thank you. Thank you.
A pleasure. All right, we also have one more expert who's not joined us yet. She's a cardiologist. She's Dr. Meenakshi. When she comes in, I will definitely introduce all of you to that wonderful doctor as well. Well, the topic for today is women's health. So we have these three wonderful doctors here with us today. So my quick question to them is, what is the status of women's health in the country today? I'm going to start with Dr. Banu. And Dr. Banu, please tell us, what is the status of women's health? Why does it need attention? What do you think is going on?
Okay. Thank you for this opportunity to be here. We are in the 21st century and we still have problems recognizing women's health as separate issues because women and men are different. They complement each other, but the health issues can be different in the two. And still, when it comes to the bias, there's definitely a gender bias, whether it comes to accepting the women or even in the health issues. Because you find many studies, the women's health issues do not take priority. Because it's mostly the breadwinners which has been taking priority, and of late you find that women's health is also coming into the forefront, especially with lots of aches and pains and fibromyalgias and work related issues are also coming in. So I think it's high time we discuss about women's health and the issues related to it, so that their productivity is improved and then they can contribute very meaningfully to the society.
Absolutely.
Thank you.
Absolutely. Yes. Thank you so much, ma'am. So absolutely. We always think, oh, breadwinner. Okay, talk about that. The women always are silent pillars of support. They're always in the background, and so is their health. I'll move on to Dr. Nandini and ask her, ma'am, please tell us from your point of view, why is women's health important? Where do we stand with relation to women's health in our country?
Okay, women, she's going to be center of the family. And if she is okay, the whole family runs in a good system. So I think women has to concentrate on her. So most of the times they tend to put their health to the next stage. They consider other people, their family, I mean, the husband and the kids, they're the first for them always. But I think once they take care of themselves, only then these people can run in their show. Like that's the most.
I agree with that. And I hope all the men and other family members are listening in today. And it's not just the women. They're the ones that should be listening. Dr. Swati, can we have your take on this, please?
I really feel that the lifestyle that women follow, where my specialty is concerned, I would say, like, the lifestyle, they don't tend to focus on themselves. Their focus, like Dr. Nandini said, is more on the family. And they tend to ignore their meals. They tend to ignore their exercise, the importance of, taking time out for themselves. probably involving in a little bit of a hobby, something other than the daily cooking and cleaning and all that, maybe a bit of. So I think women tend to put their life on the back burner sometimes, just so that, the family can be more comfortable. So I feel that if they take a little more involvement in their health and mental health, so I think we should be stressing on that. We can avoid a lot of problems for the women.
Absolutely. Women are always focused on the health of people around them, but
Around
never
them.
on their own health. Yes, absolutely. All right. So I'm going to stay with Dr. Swati and ask, can you tell me some health problems that are common to women, or rather unique to women, not common, unique to women, which they generally tend to suffer over and over again and again from?
So definitely there are the physiology of women and the way their body works is it's slightly different from the way men function. They are more sensitive to the surroundings. They get stressed out very easily. They have even to the tablets. They have more side effects to those tablets. So they obviously they have a lot of what I see in my practice. They have a lot of this condition called as irritable bowel syndrome, where it's mainly related to anxiety. They tend to fast, maybe for, intentionally or unintentionally, or religious, non-religious reasons. They're more prone for gallstones, functional dyspepsia. So it's very much related to the anxiety and the stress levels, apart from unhealthy eating habits and lack of exercise. So these are just some of the problems that I see where women are concerned.
Yes. So you're telling me that one, because of their irregular meal times and the fasting that they so often do for the benefit of the family, not for themselves.
Ironically,
Yes. So they then tend to suffer from a lot of bowel-related issues, which are very, very unique to them. All right. Fantastic. So I think that's a good starting point for us. Let's move on to Dr. Banu and
Yes.
ask ma'am, some problems that you feel are unique to women's health that are there, which men don't suffer from, or like Dr. Swati said, thick-skinned people like men are not as sensitive as women are. So yeah, tell us about that. We also, ma'am, can I just hold you and introduce Dr. Meenakshi? She's just joined us.
Yes, please.
All right. Dr. Meenakshi, welcome to the webinar. We were waiting for you as well. People who are watching in, let me quickly introduce Dr. Meenakshi. She is a member of the Cardiological Society of India, Indian Society of Cardiology, an enthusiastic, passionate cardiologist with a very patient-centric approach. And her favorite thing to do is precision diagnostic intervention. So that's what she loves to do. She does a lot of simple and complex coronary angioplasties, pacemaker implantations, also trained in aortic endovascular interventions and fenestrated endovascular graft stenting. And she specializes in adult structural interventions and percutaneous valve therapy. So I'm going to ask her later what all that is about. Okay. And she's also an author. She's authored 2 books in cardiology as well. And she's a wonderful speaker. Cracks a lot of jokes also, speaks really well in Tamil as well, just like all the other doctors that we have here. So welcome to the show, Dr. Meenakshi. Thank you.
Thank you, Joseph. Thank you for the introduction. Sorry for coming late.
Don't worry about it. We started a little early. We jump-started it. Okay. Okay. Yeah. So I was asking Dr. Banu. So I will come back to you. Let me just complete what I was asking Dr. Banu. Dr. Banu, about the problems that you think are unique to women's health. Please tell us.
Okay. One of the main issues concerned with women's health is the pain. I often hear people say, "Oh, she is the pain." I don't want to complete the sentence.
Yes.
But there are a lot of issues related to pain in the women, and women suffer much more in the perception of pain, in their reaction to the pain, because they have to do multitasking at the same time. They can't just say, "I've got a headache," and lie down. Sometimes migraine is so severe, when you have this headache and you have a lot of nausea, vomiting, and you don't want to see anybody or talk to anybody, bright lights hurt you. All you want to do is just lie down in a room, dark warm room, and just curl yourself. You don't like to be disturbed. But then you have a family to take care of, and you have household activities to be done, and you have to go to office and work. All these will produce a lot of stress in addition to the pain. And the migraine pain is also different. The severity is much more in the women. It lasts longer, and recurrent episodes of migraine produce strokes in women, not so much as in men. So that is one aspect. And in addition to that, they also have an increase of these symptoms during their menstrual cycle or the periods. So that is something which is very unique to women. Whenever, as Dr. This one I was telling Nandini, this women and hormones and brain health is also connected in a large way. And we think the brain is different in the women as well as the men. That's why you have men are from Mars, women are from Venus. And definitely the wiring is also different. Many
and
times
the way they react also is different. Yes.
Yes, yes. Many times we'll wonder, what is this? I've been talking to him and he has not listened. I think that is one of the selective
Adds to the stress.
Yeah, hearing loss. And
Yes.
so to perceive all these differences, we have to have a separate knowledge about the women's health. Many times people make fun of me. Why do you want to talk about women? Why men and women are equal in the 20th century? But there are certain things which are different in the women compared to the men. And one is the pain. And one is mainly this headache. Because the disability associated with headache is also more. Added on to that, you also have a tension headache where you just want to feel like this, sit quietly at the end of the day.
I will come back to you and ask about more on the neurological issues. This is good, right?
Right.
Okay. So anyway, I will come back and ask you. There's a lot more. I just realized that apart from learning about women's health, I'm also going to learn a lot about how to communicate with women today. So I just realized that because I have to learn to listen to them. Right. I don't mean doctors. I mean non-doctors. Okay. So I'm going to go on to Dr. Meenakshi. And blood, and then come back to Dr. Nandini after that. So Dr. Meenakshi, I've been asking Dr. Swati, Dr. Banu, and Dr. Nandini about what you think are certain other problems that are just unique to women. Dr. Swati mentioned about how they are not careful about their diet, so that leads to bowel issues. Dr. Banu mentioned about how they ignore the pain or react differently to the pain, and then it worsens. And like she said, if they're migraine, they want to rest, but more often than not, because of their responsibilities, they're never able to rest, and that adds to the problem. Yes. So you tell us, what do you think are some unique problems that you think are there in women's health?
So when it comes to women's health, like பெண்கள் முதல்ல வந்து மெயினா என்ன நினைக்கிறாங்கன்னா வந்து அவங்க இல்லாம இந்த உலகமே இயங்காது, பர்டிகுலரா அவங்களோட ஃபேமிலி வில் நாட் ரன் அப்படின்னு ரொம்ப நினைக்கிறாங்க. That is the first wrong concept. Like they are also like human beings, they need to take care of their health. That is the first thing. Okay, so generally ஏன் இதை சொல்ல வரேன் அப்படின்னு கேட்டா, like they think they have to give more time for their children, for their husband, for the household activities, for their work அப்படின்னு சொல்லிட்டு they take a long time in that. அதனால வந்து பர்டிகுலரா ஹார்ட் இஷ்யூஸ் பத்தி பார்க்கும்போது, ஹார்ட் ப்ராப்ளம்ஸ் பத்தி பார்க்கும்போது, ஆல் ஓவர் த வேர்ல்ட் லிட்ரேச்சர் பாத்தீங்கன்னா, women usually have atypical symptoms. Their symptoms are more neglected and they take delayed treatment, and because of the delayed treatment the mortality is very high. So இதெல்லாம் ஏன் நடக்குது? ஃபர்ஸ்ட் வந்து some myths are there, like நம்மளுக்கு வந்து ஹார்மோன்ஸ் எல்லாம் it is protecting our heart, அதனால நம்மளுக்கு வந்து ஹார்ட் ப்ராப்ளம்ஸ் வராது அப்படின்னு ஃபர்ஸ்ட் நினைப்பாங்க. ஸோ அந்த மித்தை முதல்ல பிரேக் பண்ணணும். லைக் விமென் ஆர் ஆல்சோ அட் ஈக்குவல் ரிஸ்க் ஆஃப் ஹேவிங் அ ஹார்ட் ப்ராப்ளம் ஜஸ்ட் லைக் அ மென். ஸோ அதனால அவங்களுக்கு ஏதாவது ஒரு ஹார்ட் இஷ்யூஸ் இருக்கு, ஹார்ட் செஸ்ட் பெயின் இருக்கு, ப்ரீதிங் டிஃபிகல்ட்டி இருக்குன்னா தே ஹேவ் டு கோ அண்ட் கன்சல்ட். தே திங்க் லைக் தே வில் நாட் கெட் ஹார்ட் ப்ராப்ளம்ஸ். ஸோ தே இக்னோர் தேர் சிம்டம்ஸ். அண்ட் பாதி நேரம் என்ன நினைப்பாங்கன்னா, லைக் யூஸ்வலா நம்ம வம்ச வழியா வரும்போது லைக் நம்ம பாட்டி, நம்மளோட அம்மா எல்லாரும் வந்து ஹோம்மேட் ரெமடிஸ் வந்து நிறைய பண்ணுவாங்க. ஸோ அதை வந்து நம்ம இன்ஹெரிட் ஃப்ரம் அவர் ஃபேமிலிஸ். ஸோ அதனால ஏதாவது ஒரு சின்னதுனா கூட சரி இதை சாப்பிட்டா சரியாயிடும், ஒரு சோடா குடிச்சா சரியாயிடும், இந்த ஒரு பெருங்காயம் போட்டு இது பண்ணிக்கலாம், வெள்ளை பூட்டை நிறைய எடுத்துக்கலாம் அப்படின்னா நிறைய அவங்களுக்கு நிறைய மித்ஸ் இருக்கும். ஸோ அந்த மித்ஸை முதல்ல பிரேக் பண்ணும். தே கேன் ஆல்சோ ஹேவ் சம் ஹார்ட் ப்ராப்ளம்ஸ். தே ஹேவ் டு கன்சல்ட் அ டாக்டர் வென் தே ஹேவ் அ ப்ராப்ளம். ஸோ தே ஷுட் டேக் அ ப்ராப்பர் ட்ரீட்மெண்ட் அப்படிங்கிறது என்னோட ஜென்ரலான ஒரு விஷயம். தே ஆர் இக்னோரிங். Okay, so
yeah, absolutely. I think we went from diet to pain and how they react to it, and to also home remedies and also myths. Nothing for us to worry. All of that. Yeah, that's very important. But let's go to a doctor who only deals with women's problems. She doesn't, you're a cardiologist and a neurologist and a gastroenterologist. You see men also, but here's a doctor who deals only with women's problems. So let's ask her. She probably might give up more insights about the problems that she sees with women's health. Please tell us, Dr. Nandini.
First thing I would start with the middle age. Middle age, whenever they're very stressed or whatever is happening in the lifestyle, their menstrual pattern changes. So either they say they miss their periods, First worry is unplanned pregnancy. Next is going to be a heavy bleeding, where they tend to neglect for a certain period of time, and they land up to us when they are very fatigued, where they're not able to do their work. That's the most commonest thing I see. Next thing would be when they go for the menopausal state. Premenopausally, they'll have a lot of mood swings, a lot of body changes happens, which they are not able to adapt themselves. And most of the women tend to think it's because of the aging, and they don't know that they have a solution for it. It can be treated. So these are the things which women actually neglect.
Okay, so as they go into middle age and then into menopause, a lot of women take time trying to come to terms with their body changes, and they tend to neglect it, which worsens it. And sometimes it can also lead to having to take treatment at a later stage, which may be difficult for them. Yes. So fantastic. I'm amazed. I mean, the amount of information that's come off just to my first question is fantastic. So diets, pain, home remedies, and certain myths and beliefs we have, and also the fact that we are not comfortable with the changes our body is undergoing. And, actually men are more of in a comfort zone because they don't have to go through the changes a woman's body goes through, be it pregnancy or, middle age or menopause. The man's body is pretty much linear, but a woman has to do it. And so definitely there are concerns with the women's health. So I'm really, really thankful to Fortis Hospital and Times of India for bringing this topic up today. And thank you for coming on board, all four of you. It's fantastic. Okay, so I'm going to stay with Dr. Nandini and ask her, in this pandemic time and in the time that you've been practicing and seeing, what are some of the common reasons for these women's health problems to, become worse? What are the common mistakes that women are doing in relation to their health? What are they doing wrong is my question to you. And what gynec related issues are they coming up with?
First thing is they're overworking. They don't know how to handle the family as well as their health, as well as their work. That was the first thing. The next thing what I faced was an unplanned pregnancy. And a lot of couples who never had kids, who were suffering with infertility issues, turned out to be pregnant. That was a very good thing which was happening. Next thing is already whoever was having an issue, health issues, whether it was a heavy bleeding or whether they had a fibroid or pain abdomen, which they were neglecting, and the and screening was something which everybody missed. After the lockdown, lot of women with lot of complications have been coming up with either anemia, or some people who have been already a known case of a cervical cancer or a breast cancer. They had omitted going for a regular routine checkups, and they had come with a very advanced state. This was the thing which I was looking at.
Oh, that's really, really sad. Okay. So first up, you were saying pregnancy related issues have been, either people are trying for a pregnancy, but not succeeding, or, they just have unplanned pregnancies, but sometimes it's good for them. It's a pretty good thing for them. So that, plus they are missing the regular screening. Yes. Regular screening for, routine things, and also for, say, cancer, post-cancer. So they are missing those as well. That's interesting. Do you remember any one story where you felt, oh, they could have come early? Why did they do this? Do you remember any personal story? If you can, one from one of your guests, you tell me now, or I will come back to you and ask you that in a bit.
I had a woman where she was having a uterus which was prolapsed from a vagina. So it was really in a very advanced stage. And the one answer what she gave me was, Doctor, corona irunduchu, adala na checkup pola. So she missed it for 6 months. Next, she comes back after a year because she was not able to manage herself. So that was the worst thing. If she had come earlier, symptoms might have been really less. And post-surgery should have had even a better lifestyle, I felt. So she was taking it for granted for 2 years because first thing,
I know,
she was very hesitant to convey it to her family members that she was suffering with.
Right. Right. I get that. I get it. So, I understand what you're talking about. And that's, I think, neglect is a big problem in women, especially in India. So I'll come back and talk to you more on how we can prevent and treat all these conditions. I'm going to go to Dr. Swati now, Dr. Swati, and ask her. So Dr. Swati, in your work, in your practice, what are the common problems you really see related to stomach and intestines, related to women? What are the common diseases that you encounter? And tell us some of the common reasons why this happens.
I think, like I mentioned before, the most commonest thing that I see, so we can probably divide into what I see in digestive systems and the liver. Okay, so because these two are the main big chunks of patients that we see. So we always tend to assume that women will never get affected with liver disease. It's something that always happens because of alcohol intake, and something that we always see in men. Recently, because of the current pandemic and the way, because of the lockdown lifestyle, like we call it, we've not been able to eat healthy, we've not been able to go out and get our routine exercises. So I am seeing a lot of fatty liver, what you would call. So the medical terminology for that is non-alcoholic fatty liver disease. This is probably the initial stages of the liver going in for a permanent damage, and this is very much treated. We can very much avoid this just by very simple measures. So also, like they say, the general myth is women will never get heart problems, but patients with fatty liver do have a very high risk for getting cardiac diseases as well. And this can be brought about by very small changes. We always think fatty liver is because of the fat that we consume, but it's totally not that. It's because of the sugar that we take. So if we avoid, if we make some changes in the diet with respect to sugar and processed foods, I think this is something that can be avoided along with good diet and exercise and other things. There are other diseases, like I mentioned, peptic ulcer disease, irregular meal timing, skipping the meals altogether, fasting, which can cause gallbladder stones, the reflux diseases. So, but apart from everything, what we really see is the fatty liver. Of course, there are other risk factors for fatty liver disease, like diabetes, obese, a bigger waist circumference. So this is what I am seeing of late in my practice, a lot of patients coming to me with fatty liver disease.
Especially women with fatty
Especially
liver.
women, yes.
Usually, as a doctor, I've been taught, okay, fatty liver. As I'm an emergency doctor, so my threshold for reacting is very, very high. So don't take that. But I'm saying, as a fatty liver, what is the problem that people will have later in life when somebody says, "Oh, you have a fatty liver"? What will happen to them later? What is the risk?
So there, over a period or a long period, for example, 10 years, 15 years, when the fatty liver goes unchecked, untreated, you don't take measures to control it, it is easily controllable. It does go on to cause permanent scarring in the liver. The liver becomes lesser and lesser elastic. So because of which it can become more stiff, something we call as cirrhosis. And ultimately
So
that does have,
that's a dead liver,
yes,
right?
yes. So that does have, beyond a point, it gives way, and there is a lot of other signs and symptoms, and they ultimately may end up in liver transplant. But this is something which can be prevented if we come out of this lockdown lifestyle, which seems to be the recent problem that we are facing due to the pandemic. So,
right, we'll talk about that in a bit. But you're saying this can be prevented, and most of it is just lifestyle changes, right? Do you remember
definitely.
any one patient that you had clearly as to somebody who did major mistakes in their life and came to you and you're like, why did you do this? Anything that stands out for you?
So there have been many patients who basically they have missed their follow-ups, they've missed their yearly checkups, their yearly scans, and they have come with I've had a couple of patients who came and they were not able to control their fatty liver in spite of sometimes in very less number of patients. Even despite the regular exercise and everything, it is sometimes difficult, and the liver does progress. So there have been many cases actually like that, where they've, over a process of 2 to 3 years, they have developed, swelling of the abdomen. And
so if they had checked themselves, it would have been great. Yeah.
Yes, if only they just did their yearly checkups, or a yearly just an ultrasound or something like that.
Okay, that's great. That's good. Okay, so yeah, so people listening, check yourself up. Okay, don't take anything for granted, especially the women. Let's go to Dr. Banu. And this is that particular unique problem that we talk about called Kai Kal Kodachal, right?
Yes.
So do you have people who come to you with that problem, madam? Or what are some of the problems that you see, and it's a lot of mistakes that women make with regards to their health? Please tell us.
Okay. This is one diagnosis which we used to write as house surgeons in the government hospital OP slip, KKK syndrome. Kai Kal Kodachal syndrome.
See, everyone's laughing. They all know this, including me.
Yeah. But now it is known as fibromyalgia.
Right.
Because this is a condition where there is a widespread. Can you hear me?
Yes, we can, ma'am. Yes, please.
Okay. You can sing, because this is now known as fibromyalgia, where there are. I don't know, sir.
So we can hear you. Don't worry about it. Just go on.
No, but somebody else is telling me they can't hear.
I
don't
can
know.
hear you.
Yeah, I
all of
can
you
also
can
hear.
Doctors? Yes, they can all hear you.
Okay.
Yeah.
So there is this widespread pain and tender places around the body. People may, I think the other link is not working, because somebody is linking in the, who's looking at the other link is passing a message that he is not able to hear.
I see. Okay.
I
That's
don't know.
out for the Times of India people. Don't worry about it. You just tell us. You're the
Right.
expert here. Yeah.
Okay. They feel that
Yeah.
there is aches and pains all over. It can be in the shoulders, it can be in the neck, it can be in the face, can be in the abdomen, it can be in the single legs, like that. Then these tender points are counted, and then you come to a score. If it's persistently occurring, say over a period of time, not just a day or two, it's occurring for most of the time, and most of the time that this is affecting your daily activities, then it's time to take care. What is very interesting is patients at least see 15 doctors, and time of 5 years passes before a diagnosis is made. Just imagine the suffering the patient has gone through for this period, of the numerous tests she has gone through before a diagnosis is made. Diagnosis is only mainly to exclude other conditions like hypothyroidism or bit.
Yeah, along with that, at the mental torture at home, where they would have told her, okay, nothing is wrong with you. You are unnecessarily
you're just
acting,
mental.
all of that drama.
Very
Right,
true.
like
It's very disabling for the patient. They'll come and cry. Nobody understands me. I'm suffering so much. My pain is.
Especially from the insensitive man. Yes.
I never mentioned you.
I'm just bringing a smile. So don't worry. Yeah, please.
Not worry.
Okay.
So, and then finally, once you make a diagnosis, a very simple diagnosis, exclude other conditions. On certain points of present, you have some scoring system. It's easy to establish. And then you know that this is fibromyalgia, and institute appropriate treatment, sometimes with the stress relieving therapies also. And then the patient does well, and there's a remarkable change in the person. Totally a new person who can handle herself, who can handle the family, who can go out and work, rather than lying down the whole time telling, oh, I'm having கை வலிக்குது கால் வலிக்குது. Say எப்ப பார்த்தாலும் என்ன வலி வலிங்கிற, வெறுப்பா இருக்கு எனக்கு உனக்கு கூட பேசுறதுக்கு, அந்த மாதிரி. From that she becomes a productive person. Then there's a lot of change, and that is very, very important to recognize, because when you have a higher pain score, then it's very difficult to do other activities, and that can also lead on to depression, which is a totally different issue. I think we can go on to it later with
Absolutely.
your thing.
Yeah. But I think it's a very, very important and pertinent point that you're making, that don't ignore the complaints that the women in your household may have. It may be something that is curable, treatable, and it can really improve their quality of life. If we ignore them, like you rightly ended on depression, that really can affect them very, very much. And of course, a happy home is where the woman, the heart of the household, is happy. Yes. And then the home can be beautiful. Otherwise, it's going to be stressful, terrible, right? Because the man will always think with his brain, he's not going to get emotional about things. But yes, the woman, if she's happy, the whole house can be a paradise for everybody. And I strongly believe in that. Okay, so thank you, ma'am, for making that point. Okay, let's go on to Dr. Meenakshi. Dr. Meenakshi, so tell us some of the common misses that women do with regards to their health, that they common complaints that they tend to ignore, which they must pay attention to, and the problems that they'll end up in. Please tell us about that.
Yeah, like as madam told, like kai kal syndrome, like many people have very நிறைய கை வலி கால் வலி அந்த மாதிரி, like they'll be keeping on complaining. அதனால வீட்ல எல்லாருமே they'll be a little bit not sharing to what they say, first of all. Okay, and what happens is like even heart problems, women don't have typical angina or typical symptoms of heart problem. So always they present with atypical symptoms only, and all these atypical symptoms will start in very, very early age, like 35, 40s and all. They'll have நெஞ்சு வலி, வலிக்குது, அங்க கை வலிக்குது, முதுகு வலிக்குது அப்படின்னு சொல்லுவாங்க. So they'll be keeping on complaining of all these things, and people, well, particularly men, think like it is an usual thing. They always complain and they ignore symptoms at 45 years or 50 years. So many times we miss making a diagnosis, or they don't come to a proper treatment earlier. Okay, so that is the main problem comparing to chest pain. Okay, the other thing is like usually women don't have much good functional capacity. They நம்ம வந்து எல்லாருக்கும் அட்வைஸ் பண்ணுவோம், வாக்கிங் போங்க, physical activity பண்ணுங்கன்னு சொல்லிட்டு. Men at 40 years of age, they start doing everything. நான் ஒரு காலைல எழுந்திரிச்சோமா, ஒரு காஃபி குடிச்சோமா, ஒரு ஷூவை மாட்டிட்டு வெளியே வாக்கிங் போற எத்தனையோ ஆம்பளைங்க இருக்காங்க. ஆனா எத்தனை லேடி போறாங்கன்னு சொல்லுங்க. சோ
அவங்க எப்படி போக முடியும்? அவங்க கிச்சன்ல தான் போய் சமைக்கணும், ஹஸ்பண்டுக்கு பிரேக்ஃபாஸ்ட் ரெடி பண்ணணும், குழந்தைங்களுக்கு ரெடி பண்ணணும். அவங்க எங்க வாக்கிங் போக முடியும்? அதெல்லாம் பண்ண முடியாது இல்லையா?
That's what I said, this 21st century. Buckle up.
The women, they don't go unless they have a very serious problem. So அவங்களோட functional capacity is very less. அவங்களோட minimal household activitiesக்கு எப்ப limiting symptoms வருதோ அப்பதான் வந்து they become okay, நம்மளுக்கு ஏதோ ப்ராப்ளம் இருக்குன்னு சொல்லிட்டு. Particularly breathing difficulty, because women are always ஒரு மாதிரி ஒபீஸா இருப்பாங்க, ஃபங்க்ஷனல் கெப்பாசிட்டி கிடையாது, டெய்லி வாக்கிங் போக மாட்டாங்க, எதுக்குமே வெளியே போக மாட்டாங்க. ஸோ அவங்களுக்கு அது ஃபங்க்ஷனல் கெப்பாசிட்டி வில் பி வெரி லெஸ். ஸோ அவங்களோட ப்ரீதிங் டிஃபிகல்ட்டியையும் வந்து வில் பி மோர் லைக் அண்டர் எஸ்டிமேட்டட். ஸோ இது எப்பவே ஏதாவது கம்ப்ளைண்ட் பண்ணிட்டு இருப்பா அப்படின்னு சொல்லிட்டு தே ஆல்வேஸ் டூ இட். அதுக்கப்புறம் இன்னொரு காமன் சிம்டம் which I see in women is like giddiness. Okay, many of the women complain of giddiness, and sometimes when they have an organic problem, an organic giddiness, that time also it is very underestimated. And most of the women, they have a thyroid problems. Like most of them, they have a thyroid problem associated with it. And palpitation is one another complaint which is always ignored in females, unless they end up with a very major thing like or a syncope, loss of consciousness vandadukku apparama வந்து it will all be addressed. Okay, so these are the common cardinal cardiac symptoms, but ellame வந்து will be misguided because of their make like they always keep on complaining. அந்த மாதிரி சில விஷயங்கள்னால நம்ம வந்து அந்த கம்ப்ளைண்ட்ஸ்லாம் எப்பவுமே மிஸ் பண்ணிடுறோம். So even though
right. So
they should come.
Yeah, I completely understand what you're saying. Yeah, they should have come early, but they are complaining to people who may not take it seriously, or they themselves are of the mindset, well, it's okay, we'll take care of this later, let's take care of what is important. And for them, important is everything around them other than themselves. So adanala, there is quite a bit risk. But according to what you're saying, they are also at high risk for developing heart attacks. And these are some symptoms we should not ignore, like chest pain, breathing difficulty, giddiness, palpitations. These are some things that must not be ignored, correct? I had a relative very recently. I was called to the house to see her. A 55-year-old lady who had developed breathlessness after going to the washroom and coming. அவங்கள்ட்ட நான் சொன்னேன், I examined and I said, உங்களுக்கு probably heart failure இருக்கு. She wouldn't accept. She said, இப்போ வரைக்கும் வந்ததே இல்லை, it usually எனக்கு அப்பப்போ வரும், so this is nothing. What is this, doctor? Why are you saying such things? I tried to really convince her, but I failed. And even though she was my own relative, I gave her some medicines to satisfy her. 2-3 days later, she ended up having to go to the hospital because the breathlessness worsened. I mean, she's currently still in the hospital, actually. This is a very recent case. So I completely agree with you when I see women ignoring or underestimating what they are going through. So I think that definitely something to be addressed. And she's just out of her reproductive age group. So, there was a problem, right? So that's correct. That's correct. Oh,
I had one
sorry, tell me, madam. Yeah.
Patient had jaw pain. Okay, so she was keeping on telling jaw pain. Okay, everybody were telling like you have some caries tooth, so don't worry. She consulted a dentist also. He also told her no, it's only like no need to take some analgesics. So after 3 days, she developed breathing difficulty, and then she ended up here and had a triple vessel disease, and she underwent PTCA. At the time I told her, even jaw pain can be a cardiac problem. இது எப்படி மேடம் எனக்கு தெரியும், நான் இது வரைக்கும் அந்த மாதிரி பார்த்தது இல்லை அப்படின்னு சொல்லிட்டு. So that is why even for small symptoms, like we take self medications and then we end up with a major problem. Okay.
Yeah, I think just ignoring or neglect is a big problem. I think all of you doctors have made that very clear. Don't neglect any of your symptoms. As a woman, you are the heart of the family, and your health is key to having a happy family, a happy home, and probably a happy world, I suppose. Okay, let's go on to Dr. Nandini and ask, madam, in your experience, in your opinion, we did talk about the mistakes that women are making. What are the correct things that women should do to maintain a good gynec or OBGYN health? What is the thing that they must really do well? Can you just enumerate 1, 2, 3, 4? Enna correct up on what should women take care of?
First thing is they have to maintain their weight. weight maintenance post-delivery or post-surgery is something all the women tend to miss it out. They tend to think they have to take rest and they take care of the other things. So they have to work on their weight maintenance. According to the height, they have to maintain the weight. So BMI has to be calculated for them. So what's the importance of this is when they're obese, when you're in a younger age group, your cycles will become irregular. They can go for a polycystic ovarian disease. Next thing is when you go into a middle age group, along with your weight gain, sometimes you can have a thyroid problem also. So that will again add on to her menstrual problems. Next thing, when she goes into older age group, her knee pain is going to be there. And going towards the menopause, a fracture rate and your breast cancer becomes more when they're very obese. So screening has to be done. So that's one first thing. Next thing is their own self-care. In self-care, what I would say is for a female, whenever you have your cycle, post-cycle or during your cycle, please do your self-breast examination. That's the most important thing. Whenever somebody has a family history of their mother, grandmother, somebody's had a breast cancer or ovarian cancer or uterine cancer or a cervical cancer, they should go for a yearly once screening program. It's something very mandatory. And the third thing is, I would say as an adolescent or when they go into reproductive age group, every woman should have their HPV vaccination to prevent a cervical cancer. And the fourth thing I would say is, whenever you have a very ambitious career, plan your pregnancy also according to it. As you age, your ovaries also tend to age. So you have to have a planning for your pregnancies. As well, preconceptional counseling will help them how to go about with the very healthy pregnancies. So once their pregnancy goes into the higher age group, what happens is they tend to get either a high BP or they tend to develop diabetes during their pregnancies, which later on when they go into their advanced age group, sometimes they can develop a hypertension as well as diabetes. This woman has to address to it. And fifth thing is, whenever you have your number of pads, which you change your pads to mini pads or you pass clots or feeling giddy, make sure that you're not bleeding very heavily. Don't take it for granted. And please address it to your family members. Nothing is, first they go into denial state, then they feel nobody hears them. That's the most important thing. And they are very embarrassed. Now we're in 21st century. I think we should talk about the women's health to your key. That's the most important.
Absolutely. I mean, I'm a doctor, so thankfully my wife finds it easy to talk to me about these things, but not all men are like that. Yes. Sometimes even the men find it awkward because they don't know what solution or support to offer. Sometimes just listening can be a big source of support for the women, and then taking them to the right doctor. You don't have to be the doctor for your wife or your loved one, just take them to the right doctor and they can help. So let's quickly, because that was a lot of information in 2 minutes. So even I was finding it difficult to keep track. So let's say, so first is of course, weight. Weight is very important for women. I'm sure all the doctors will agree. Weight coming to digestive issues or, pain related issues or heart attack. I think weight is a very, very key factor. And I think related to fertility and, hypothyroid, hyperthyroid, or ovarian problems, again, weight is a big thing, right? So weight and good exercise is ரொம்ப important, number one. Number two, this HPV vaccine that you said, I think I'm very, very glad that we touched on it. Women who, before they become sexually active, must take an HPV vaccine, especially adolescent women at the age of 16 to 17, I think must take it because cervical cancer is increasingly becoming a bigger and bigger and bigger problem. And the vaccine can prevent that. We also mentioned about heavy bleeding during cycles, and they must not ignore that as well. Yes. And after that, we mentioned diabetes and hypertension, so I'm kind of lost. So yes, so you talked about diabetes and hypertension. Yes, please. Yes. So these are some things that they tend to develop later as they go on in life. So they must. But I think you really mentioned regular screening. Come and get yourself screened. And I forgot the most important thing. The biggest cancer in the world is breast cancer. And you really told them before and after a cycle, please self-examine yourself, learn how to self-examine, and then make sure that if you feel any lumps, go to the doctor, get it screened. That probably can save more lives than anything else in the world. October is Breast Cancer Awareness Month, so we are going there. So thank you for making all these valuable points, Dr. Nandi. There was a lot of information like this, and I was like, okay. But anyway, such lovely and valid points, women's health right there for you, all of you watching. Okay, let's go on to Dr. Swati and ask her some more. Let's pick her brain a little bit more. Dr. Swati, Dr. Nandini mentioned about what are the things that a woman must do right with relation to her gynec health, obstetric health, keep track of her fertility, plan your pregnancy better. All of that she did mention. But what about her digestive health? Tell us, with relation to her digestive health, what should a woman do right? Please tell us.
So I would first place emphasis on eating a very balanced diet, which should have everything: carbohydrate, protein, fat, and it would be include healthy fats and restrict the amount of processed food and white sugar. That really is an enemy for fatty liver disease. And I do not find any benefit in going for these keto diets and those kind of things, as long as there is no need to cut out any element of your diet, as long as you include everything.
I'm going to stop you because again, I realize like Dr. Nandini, you're going to give me so much information. I'm going to have difficulty in keeping track. So let's come to diet. Okay.
Yeah.
So you said avoid fatty foods, avoid processed food. So processed food means frozen food,
all the
tinned
junk,
and canned foods.
yes, all the junk food which has a lot of preservatives, which has a lot of sugar, like mixture, murukku, all those norkatini items which we are increasing.
I think a lot of will come to Dr. Meenakshi's patients.
No, our consumption has increased so much during the lockdown.
Right.
You know, you just keep eating the mixture, and I think we're all guilty to that at some point or the other. But that's what I would tell to limit. Number two is at least a moderately intense exercise of about 30 minutes per day for 5 days is good enough for you to. I mean, if you can do more than that, that's well and good. But this is at least that is what is required to prevent fatty liver and for the general well-being. Also to decrease the stress and anxiety levels. You can take up a hobby, you can go for yoga, which is very, very good. We find that it helps a lot of people, even men. So that is one thing. So this is the lifestyle modification. The next thing that I would say is to not ignore the warning.
So, I'm going to say, okay, what about leftover food? A lot of women, and my wife is also guilty of this. Okay, I will have that. Oh, is this leftover? I will have that. I think leftover food is the biggest bane of all women in the country. I think. Don't you agree with that?
I totally agree with that. But sometimes I think we can't do much about it. But it would be great if we could.
She runs her family. I can tell she runs her family.
It has helped us a lot during the lockdown to just carry forward the food. But then that is a practice I think we should do away. And instead we can make something like salads, which are as quick and easy to whip up and not time consuming to cook. So
absolutely. Yeah. Okay. Please continue. You said lifestyle modification.
Lifestyle modification is one.
What else? Right.
Yeah. So the other thing is not to ignore the warning signs. A lot of women that I see, they have excessive tiredness, and they would just say, if I sleep it over or if I just take some rest, it will be fine. But I think they should come out and get it checked. Excessive tiredness, loss of weight, loss of appetite, black colored stools, and these kind of extensive itching. I think they should not miss out on these warning signs. And most of these you can pick it up if you go for yearly tests. If you just go for your yearly health package, and if you just we have very advanced, accurate scans other than ultrasound now called fibro scans, which will less than 5 to 10 minutes they pick up how much fat is there in the liver. So that is more accurate, and it is quicker, and it is painless. So I think if we can incorporate all that into our life, like a yearly scan, a yearly checkup, a visit, to make sure everything is okay. That is one. And another thing is I would suggest is a hepatitis B vaccination for everybody, because if there is one in my field, if there is one carcinoma we can prevent, it's hepatocellular carcinoma. You identify patient is hepatitis B negative, I think we should encourage vaccinations for them. So these are like some of the things that would overall help a patient.
So eating right.
Yes.
Yeah, exercising right. Make sure you get screened regularly and take a hepatitis B vaccine. I think most of us as doctors would have taken the hepatitis B vaccine, maybe nurses as well. But common people usually, I think nowadays in my vaccination schedule, it's there, but otherwise common people usually would miss out. If they're hepatitis B negative, they must get it. And it can reduce the incidence of liver cancer, right? So That's what you're telling us. Fantastic. Thank you so much. And I'm glad I broke that up so I could summarize that. Okay, let's go on to Dr. Banu now and ask her, Madam, HPV vaccine IDC, hepatitis B vaccine IDC. So in neurology, do we have another vaccine where we can prevent this pains and aches?
Oh, no,
Right.
not for pains and aches. You have meningococcal vaccine, but I'm not going to that
Right.
because that is not with the present discussion.
Right. You tell
But
us
of
what
course-
women should do things right. That's what I want to ask.
Okay.
Yeah.
See, women have a lot of wrist pain. You know,
Mhm.
this is related to activities which involve the wrist, hand pain. They'll come and say, yo, நான் படுத்துட்டா கை மறுத்து போயிடுது, இந்த 3 விரல் ஃபங்க்ஷனே பண்ண மாட்டேங்குது, என்னால புடிச்சு கிளற முடியல. Then I'll have to go into the details of what they're doing. And you will be surprised. One family had 20 members and the daughter-in-law had to do the chapati for all of them. Nobody
Oh
to
my
help.
God.
She makes
Oh my
about
God.
60 chapatis morning and evening.
Oh my God. Okay.
Then I
okay.
said, you just have to get help because they find it difficult to tell. So I tell her next time, bring your mother-in-law. So the mother-in-law, she can get the support of the mother-in-law. Not all can have a mother-in-law like me who's very supportive. That's why my profession, I'm able to do all this.
Yes,
Okay,
yes, I'm
then-
sure. Yeah.
Though there are chapati making machines, everything, some of them have some peculiarities. So that second thing
Right.
is to have a proper posture when you're using your computer or laptop. Many times we put pressure on the wrist when we are using the keyboard. Not to do that because that's where the carpal tunnel is and there can be some inflammation in the wrist which can produce a carpal tunnel syndrome. And to avoid that, you can have something which is soft. Like I tell them, put a thing like a soft cushion or even a Turkish towel rolled up. Put your hand on it rather than a hard desk or the table, so that there is not much pressure. And periodically to move the hands. And nowadays you have the text neck syndrome. Keep on texting and there's a neck pain. So
Yes, I'm going to straighten up now. Sit like this now.
go,
Okay.
yeah. See, and that is actually what you said is very true, because if the computer, the laptop or whatever is, the screen is not in proper height, you tend to stoop. And if you're working for long hours in one position, the muscles in the back of the neck become very stiff, produces a lot of pain. And because this continues day in and day out, in and out of office, and then this produces a lot of problem, especially during the lockdown, because they were working much more at home rather than in the office, with the children also on the online classes. So they were much more stressed also. So stress also produces a lot of muscle tension, and so that produces pain. So we tell them that when you are using these screens and you're using an idle, you're sitting idle, just do a few movements of the neck. Look right, look left, look up, look down, do some movements so that the neck muscles are not in one position, all contracted. They are able to relax because of the different movements. And then the shoulder pain is also there because of abnormal posturing. You have to make sure that you exercise properly and maintain a good posture. Back pain is also avoided. Having said all that, stress can contribute to a lot of these pains. And so I think women should learn that they need not always be a super woman. They can always ask for help and then take the help of their family members. Family members may be quite willing to help. Sometimes we do not want to trouble them and ask them, and we give them more trouble in the end. So it may be ideal to ask for help in the beginning stage, and or at least get some assistance if you're working and you can afford it, or reduce the amount of work you're doing. Don't get overburdened. Don't go into the burnout syndrome. That's my message for the day.
Fantastic, madam. Fantastic. And I'm really, I'm how do you say, envious of your daughter-in-law. Do you have a daughter-in-law?
No, I don't have my mother-in-law only.
shucks.
You have to be envious of me.
Okay. All right. Anyway, thank you so much. So wrist pain, so make sure you're not unduly stressing your wrist. Don't do that. Also hands, constantly working on the laptop. I mean, a lot of women are also IT professionals, so they have to, doctors have to do a lot of work on the laptop. So make sure that you don't get stressed that way. And whenever there is stress, make sure you find an outlet for it and make sure you tell somebody who can help at the beginning stage. Then it's easily treatable. Otherwise, it may worsen, lead to depression, or you may react badly to things. And psychosomatic problems can happen. The body can also get affected by these issues. Thank you so much, ma'am, for putting all of that together. And it's wonderful to talk to you. I feel like I could just keep talking to you, that
Thank
relieves
you.
a lot of stress.
Oh, thank you. My
right.
day is made.
Oh, thank you, ma'am. Time is flying, so I have another 4 or 5 questions coming in. But before that, I have to ask Dr. Meenakshi, madam, tell us, what are the things that a woman must do right to maintain her heart health? Please tell us that, and I will ask some questions that are coming in for you. Yeah.
Actually, many people have talked about lifestyle modification, my colleagues. That is very important part. I am focusing on once you enter 40 years of age, as you do a pap smear, you do a breast examination, you have to do screening for hypertension, diabetes also, because these two are very major diseases, and India is an epidemic for diabetes. It's a capital of diabetes, and so diabetes and hypertension makes the vessels very ugly, and they are more prone for cardiac problems like having a heart attack. So at 40 years of age, you have to start screening for hypertension, diabetes with annual checkups at least, and then you should have a check on your lipid profile also. That is one thing. And coming to physical activity, as Swati told, we have to start on physical activity, maybe going on a walking, cycling, jogging, all these things may be okay at least 4 times a week. Everything we talk regularly. But what women can do is not going regularly on a walking is not possible for them. So you go at some time, whatever is feasible for you, maybe in the morning hours or evening hours, or if you cannot go for such physical activity, involved in some group activities, people are joining, many housewives are joining, doing some Zumba activity or some dance activities. So involved in all those things. This will help you in doing some physical activity, and at the same time will help you in relieving your stress also. And yes, ma'am.
Can I just add?
Yes, please.
There are some programs on net where they help you to do these activities. I forget some names are there, where they also do the exercises and you also do. So you feel you've got a company to do it. Always get hold of a partner to do the exercise. It's always better.
I am part of a group of people who are 60 plus, and every month they have these Zumba class for people. They have these online skits for people. So they do all of these activities for older people also. So there's no excuse for younger people to not do it. Please go on, Dr. Meenakshi. Please tell us. Yes.
Stress relief, men indulge in smoking and alcohol once they have stress. Okay, but what women do is they start a lot of binge eating. That is a habit in many women. When they go into depression mode or they have more stress, they go for binge eating. It is a vicious cycle which starts with increase in the weight, and then you are more prone for hypertension, diabetes, your hormone levels are altered, and you end up with some cardiac problem, you end up with all sorts of problems. Okay, so how to avoid stress is another important thing. But when you have stress, don't involve in binge eating. That is one another thing I want to tell women. Okay, and so physical activity, diet is, as Swati told, we have to have less carbohydrates and more fresh vegetables and fruits is always very essential for having a healthy heart. Okay, so focus on your diet, do some physical activity, keep yourself stress free. That's what I want to tell.
Fantastic. And do regular checkups. You mentioned that very clearly. Do regular checkups, keep your diabetes and hypertension under control, because all the binge eating, bad sleeping, poor meal times, everything, which we think are, Dr. Swati's issues, patient's issues, and lead on to Dr. Meenakshi's patient issues after that. So everything is interconnected. Women's health is all there. Okay, everything is interconnected there. Okay, so please, people, do all of that. A lot more questions I think I have, and I have only about another 10-15 minutes to go. So let me, before I go into the questions that are being asked, one quick question to all of you, and all of you can answer in turn. Should women get vaccinated for COVID-19? I mean, so COVID-19, what is your advice? Let's start with Dr. Swati. Tell us, vaccination, COVID-19, what do you say?
Definitely, I think it's that one area where women and men, we are equal to men, where we should get vaccinated, and there is no, it's not like we are women are sensitive and should not get vaccinated, or you don't get vaccinated because you're in your menstrual periods. It doesn't matter. All women have to go and get vaccinated above 18 years as of now. So I would really recommend it for everybody. Yes.
Dr. Nandini, what do you say about vaccination, please?
All the women should get vaccinated, and pregnant ladies, mandatorily, you have to go for your vaccine.
Covishield, good. Pregnant ladies, no problem. Shall we put them on that?
All the vaccines are safe for the pregnant ladies. It's Covishield, Covaxin, whatever. Get yourself vaccinated first.
All right. Okay, there you have it. Now she's telling you, so even if you're pregnant, go and get it. Yes. All right. Excellent. Vaccination. So don't know, pregnancy is not an excuse anymore. Okay. Yeah. All right. Okay, Dr. Banu, what is your opinion on vaccinations?
Yes,
Okay.
yes,
Everyone should get
definitely.
vaccinated.
Yes, self-care is the best care. Only then you can take care of others. So yes,
Fantastic.
apart from
Oh,
mask and other issues.
absolutely. Yes. Self-protection and then vaccination. Dr. Meenakshi, vaccination, what's your point of view?
Actually, there was a lot of negative feedback about vaccination in initial days. But what I feel is like we have eradicated polio. Like when we were childhood days, we have seen a lot of polios, measles, and everything. So we have come across like we have eradicated most of the diseases by vaccination. So whether it is effective or not, it is a second question. But you have to get vaccinated. So there is a scientific evidence for it.
Absolutely. So get vaccinated. So women's health, all the women listening in, all of these wonderful doctors think you must get vaccinated. So please don't hesitate. All the women, and don't believe all these WhatsApp messages you get. Okay, go get vaccinated. Okay, so let me quickly get into some questions that I have. I think this one is for Dr. Swati. I am 45 years old without any disease or disorder. Is it okay to fast? Can I fast twice weekly? I think it's a woman who's asking the question, but this is her question. So, Dr. Swati, can she fast twice a week?
I would need to know more about how, I mean, if she's going to be fasting the whole day, and that definitely above 40 years, I would not recommend. But there are other aspects of fasting, like intermittent fasting, which is supposed to be very beneficial for lowering your blood sugars and those kind of things. But a total complete knockout fasting is really not good for your gallstones, especially above 40 years of age. So I would really need to know how is her fasting going to be for me to give a very
Is she
accurate
like
answer.
completely going to cut off everything for 24 hours, or is he going to be intermittent fasting for 12 hours, whether taking something, not taking something? Okay,
There are some
sense,
people
makes
who
sense.
fast only on fruits and vegetables. That should be okay.
That should be all right. Okay, so there's something that's going, some activity that's going on in the body, that's all right. Yeah, completely starving yourself may not be appropriate if you're doing it for extended periods of time. Okay, so that was that question. This one is, I think, for Dr. Meenakshi. My mother recovered from mild COVID about 2.5 months ago, and she's also taken the vaccine. She's over 55. I am worried about heart issues as a result of COVID for her. How can I protect her?
COVID vaccine.
Person.
They are worried about the COVID.
No. They're worried about having had COVID 2.5 months ago. And now are there going to be heart issues because of having suffered from COVID? Not the vaccine. They've had the vaccine, but they're worried about the COVID side effects. Yeah.
So actually, in general practice, like a post-COVID, we are seeing a lot of patients who come with some atypical chest pain. Okay, predominantly it is atypical chest pain, and sometimes what happens is they chest pain, on keeping on evaluating, we find that they are sometimes TMT positive, and sometimes we go till doing an angiogram and proving that nothing is wrong. Okay, that is one group of patients. And another group of patients is like post-COVID, we see a lot of young patients having hypertension. And that too, those who are hypertensive are having very uncontrolled hypertension. That is one other thing which we face a regular problem. It doesn't mean that you have a mild COVID, then you will have a heart problem. Some people who are having moderate disease or even a severe disease, they are only facing these kind of problems in the post-COVID period. So COVID alone doesn't mean that you will have risk of heart disease. If you had a mild disease, then the risk of heart disease is very less. And if you even have a moderate or severe disease, your D-dimer levels are okay, your troponins are not elevated, you didn't have any ECG or echo abnormalities during the thing, then your possibility of having a heart problem is very less.
All right. Okay. So if there's severe disease, yes, there is an issue. But during mild moderate disease, if they didn't have any heart-related ailments, then it's a little less likely for them to have it. But anyway, I'm sure the doctors would have put them on anticoagulants for about 2 to 3 weeks after having suffered from COVID. Okay, this one is for thank you, Dr. Meenakshi. This one is for Dr. Nandini. I had a cyst removal surgery 1.5 months ago, and my last 2 menstrual cycles have become more painful. Should I be concerned? This is her question.
No, I don't think so. As she has undergone a surgery, she might have a minimal amount of fibrosis where the other organs, where the parts would have been stuck with this. And over a period of time, she'll settle down. If the pain is very persistent, she has to go for a checkup. It's very simple.
All right. Oh, fantastic. Thank you. Simple answer. So don't worry about it. It should settle down in a little while. I also have one question for இல்ல நியாயமா கேட்டிருக்காங்க எல்லாருக்கும் ஒரு question கேட்டிருக்காங்க. Okay. I have one question for Dr. Banu, where this is, I think, a young person who's worried about their mother. And the question is, my mother in the recent past, she's about 55 now, and she's beginning to suffer from giddiness persistently. She's getting giddiness quite often, every 2 or 3 weeks, I think. She's complaining of giddiness. That's what this person is asking. I don't know if it's male or female, but it's about the mother. Should they be worried about it, Dr. Banu?
Okay. See, giddiness is a very common symptom which is present in many conditions, right from anemia in one end to anemia, stress to the other end, where there's a blood supply to the brain gets affected. If giddiness is associated with certain other symptoms which indicate brain involvement, like seeing double, not able to speak, not able to swallow, having weakness which affects one side of the body, or some numbness affecting some particular region, then definitely they have to go see immediately. Having said this, the giddiness can also occur when there is a vestibular disturbance. That is much more intense, more associated with other features like sweating, palpitations, nausea, vomiting, and prostration. So that is a different issue. Having said both, then you have what is otherwise known as a depression, where that can also manifest as giddiness, multiple somatic symptoms, where they may not be eating properly, they may not be sleeping properly, lack of sleep, and they can have other issues which are contributing. They may be on multiple drugs also, which can also contribute to giddiness. So we'll have to see what is it that is producing the giddiness in this particular person's mother, and then decide whether this has to be taken seriously or not. But whatever it is, make sure that the person doesn't go out alone and has a fall and has some break some bones. So they have to be cautious and not to go near the gas fire, where the giddiness should not produce a fall and lead to an accident.
Right. So whatever it is, the symptom must be taken seriously until we can make sure it is not something to be worried about. Something related to brain, get a scan or whatever done. But best thing is to go see a doctor and then explore these options. Yes, they will decide whether it's to do with the brain, or is it to do with depression, or is it something else that can be treated easily or not. Okay, but like you said, take precautions, don't let them get into trouble, right? Okay, so that's that. I have another question. I think Dr. Meenakshi, any of you can answer this. There's a myth that men are more prone to cardiac arrest and probability of women getting it is less. Is that true? That's the question. I think Dr. Meenakshi, you can tell us. Do women get less cardiac arrest? You're mute, ma'am. I can't hear you. Yeah.
Actually, cardiac arrest occurs only in acute coronary syndromes. That is like when you have a heart attack, maybe a ST elevation MI or a non-ST elevation MI, you don't need to bother about it. When you have a heart attack with your elevation in your cardiac enzymes, then only you are more prone for cardiac arrest, because the whole myocardium is very irritable. Okay, so when it comes to an irritable myocardium, the myocardium doesn't know whether it is a male or female, so they are both are more prone for equally prone for cardiac arrest. Okay, only thing is, like, women, according to the world literature, women are more prone for mortality and cardiac arrest because of heart attacks, because they usually neglect their symptoms. They have a delayed treatment. So that is proved worldwide. Okay, so if you take that into consideration, yeah, probably women are more prone for cardiac arrest than men. So always keep your women safer.
All right, keep the women safe, people. Listen to the doctors. Okay, so I think I've only got about another 5 or 6 minutes left. So one question which is there and it's pertinent is, what are the regular checkups that you advise for women above 40 years? And are there any medicines that they can start? That is the question that's been asked. I'll start from Dr. Meenakshi and then go on to all the other doctors who can advise or add on to it. Yeah.
So after 40 years, as a cardiologist, I will suggest, like, you have to keep a check on your blood pressure levels. At least you should check your blood pressure levels once in 3 months if you are not a hypertensive, or if you are hypertensive, you have to check it at least once in a month. Okay, and then diabetes, you have to have. If you are not a diabetic, have at least 6 monthly check on your sugars after 40 years of age. If you are a diabetic, have it at least done 3 months or every month based on your diabetic control, and keep a HbA1c less than 7. Okay, that is my advice. And then coming to the lipid profile, you have to check your lipid profiles and keep your bad cholesterols at a lower range and keep your good cholesterols at a higher range. These three things I usually advise for all the people after 40 years of age.
Okay, so lipid profile, your blood pressure, and your sugars, keep it under control. Okay, thank you. ECG solely. Okay, not needed. Okay.
Yeah, for an annual checkup, you can have like annually you check your ECG, echo, and a TMT. That can be done every yearly once. That be okay.
Right.
But
Okay.
what happens is like what the question we usually have to ask is like நீங்க TMT பண்ணீங்க டாக்டர் நல்லா இருந்தது ஆனா எனக்கு ஹார்ட் அட்டாக் வந்தது ஏன்னு கேட்பாங்க சரியா. They don't understand the pathology of everything. Okay, so we don't
Exactly.
insist much like it is going to pick you only the chronic or stable coronary syndromes. It is not going to pick up people who will have a heart problems. Okay, what I said about
Absolutely.
hypertension or diabetes is about the preventive aspect, but you cannot prevent having a heart attack. If you prevent the risk factors, then only you can prevent heart attacks. But doing a
Perfect.
ECG, echo, TMT is not going to prevent you from having a heart attacks.
Exactly what my relative told me, a few days back when I said, she said, my ECG was fine. Why am I getting this? I said, okay, perfect answer. Thank you. I'm glad I asked that question. Okay, let's go on to Dr. Swati and ask her, ma'am. So here we already mentioned blood pressure, diabetes, and lipid profile. What, in your opinion, must a woman, keep checking after the age of 40?
So with respect to gastro and liver diseases, what I would also add a liver function test and a kidney function test. And a yearly once ultrasound abdomen is what I would recommend. If not, then at least a yearly once fibroscan. The fibroscan will check only the liver, but in the ultrasound, you can get to see the gallbladder, like everything. So it probably forms a more comprehensive examination. Also, there are guidelines that above 50 years in US and UK, they undergo a mandatory colonoscopy, once in 5 years. It's something that we don't follow here. At least we can start, if people would be willing to do that, I think that would be a very good practice to follow, to screen the colonoscopy for any polyps or any growths, or just for the general screening. So this is what I would add to it.
Fantastic. So liver health, kidney health, and ultrasound abdomen. And we're doing these fecal tests nowadays, fecal immunochemical tests that we're doing. But I think, yes, colonoscopy, if I remember the data right, has reduced the risk of colon cancer by almost 60% in the US. It's come down huge because
they
of the
have
screening.
they have a very strict protocol of screening all patients above 50 years of age every 5 years, which is something which we don't do unless we have alarming symptoms, and by then it's probably too late. So I think that is a good thing which we can probably include and educate the public to, because we would be preventing a lot of carcinomas, cancers.
Fantastic. All right, let's go on quickly to Dr. Nandini. Thank you, Dr. Swati. Dr. Nandini, tell us, what are the tests that we must do as a woman? I said we. Okay.
We are part of women's.
Yes, we are. Yeah, tell me.
I would say a woman has to have a hemoglobin checked. A drop in a hemoglobin will give us a lot of information about our cycle as well as the cardiac health. Next thing is ultrasound, which will talk about the uterus, how the uterus, whether it is got, as they age after 40 years, they tend to have fibroids, a lot of issues are there. So an annual ultrasound is mandatory for the pelvis. Then a mammogram when she crosses 40 years. Then a vitamin D has to be checked for all these women, because we do see a lot of them having a vitamin D deficiency, and just the calcium supplementation alone will not help them. And going towards menopause, they should be aware of their menopausal symptoms, and hormonal replacement therapies can be given to them whenever they suffer with these symptoms.
Fantastic. Thank you, Dr. Nandini, for saying all this nicely and quickly. So quick, and so much information comes from her. Dr. Banu, yes, please, your comments, ma'am.
For me, it's very difficult because they have already said. So mine is a very simple. Check on your husband's social media. Cell phone. That keeps your brain health active. No, jokes apart.
Right.
Check on the family. And of course, keep your brain active. I'm not telling any of these checkups. I'm telling to be physically and mentally active. Use your brain or lose your brain. Now we know brain is no longer like before, where once it goes away, it's gone. Now we have neuronal plasticity, where there's a lot of scope for rewiring. Learn something new and try to connect with friends and family, especially those with friends are the best stress busters. Nothing like having a friend as a psychotherapist. Nothing else. Just when you're just stressed, give wings to your stress. Let it fly away. You don't get to hang on to it. And best is the social media to some extent, not too much. Another thing will be reading a book or enjoying yourself. Whatever it is, whatever you like, music, family, kids, everything is fine.
Oh, I think we need more doctors like this. Thank you so much, Bev. It's such a pleasure talking to you. I really want to ask you all for final messages, but we're already touching the 5 o'clock mark. So I'm not sure I really have time to ask you anymore, but it's been such a wealth of information, and with such 4 wonderful doctors here, the time has flown, and I can't really tell you how we've just run through an hour and 10 minutes plus of a discussion on this webinar. So it's been a pleasure talking to all of you, and I must thank Fortis Hospital and Times of India to have brought all of you here. I think I have another quick 3 or 4 minutes that I can talk to you all about. One line, if you wanted to give a message. I think Dr. Banu has already given us wonderful messages, and the last message was great. From the rest of you, one line that you want to give a message as to women out there. Let's talk to Dr. Meenakshi. Please tell us your message to the women out there.
So rather than giving a message to women, I'll give a message to men, okay? So women teach you what is love. So they are the heart of the whole family. So keep their heart healthy. That's what I want to tell them.
Wow, that's a wonderful message. Thank you. I hope all the men are listening to that. Okay, Dr. Nandini, please.
Yeah.
Your message.
Women have to have this self-care. They have to give time for themselves. Have your own time with your friends or whatever you want to do. Have some time for yourself, at least yearly once.
Fantastic. Thank you. Dr. Swati, your message, please, ma'am.
I would really say women should speak out more about their problems and seek help, and try to devote more time to themselves and reduce their stress. I think the key is in the stress and in the lifestyle more than any checkups or more than anything else. I think that's what even the pandemic has taught us, that the amount of stress that can wreak havoc. So I would say, pick a new habit, pick a new hobby, and to take care of your health.
All right. Thank you so much. Dr. Banu, any finishing touches are there? Final touch, Irka?
Right. I would say fly high. Sky is the limit for the women.
Oh my
Okay,
God.
fly
Thank
high.
you so much. Thank you. Thanks. You are all not just wonderful doctors, but such inspirational women. I enjoyed this conversation. Absolutely. And I was wondering, okay, women's health, and I'm sitting here. I'm actually glad I'm sitting here, because I think all men need to listen to this. All men need to listen to such wonderful doctors and women talk about women's health. So thank you once again. Thank you, Fortis Hospital. Thank you, Times of India. Thank you, Dr. Banu, Dr. Meenakshi, Dr. Nandini, and Dr. Swati for joining us. It's been amazing picking your brain. And like I said, time has flown, and now it's time for the women to fly high. I'm going to steal that line from Dr. Banu. All right. Thank you so much. God bless you all. And I hope to see you all again soon on another informative webinar right here. Thank you.
Thank you so much.
Thank you. Our pleasure also.
Thank you.
Thank you.
Thank you. Thank you.
Thank you. All right.